So vascular access device consideration of especially PICC line. So objective of today's meeting is understanding the global guidelines related to PICC, understanding Indian practices, understanding and resolving barriers, and towards consensus guidelines for PICC use in India. Although venous access may seem minor, it can dramatically affect a patient's ability to receive appropriate treatment. So indirectly, it affects the course of disease. So do we need an Indian algorithm on how to use PICC in our cancer patient? The answer is yes. And there are certain points that need to be addressed and answered. So is awareness is lacking? Are we not making full use of training opportunity and material? Casual approach is leading to significant complications. Dedicated venous access team need to be strengthened, and several unique Indian experiences has led to unique solutions. So first we'll understand the global guidelines. 70% patients receiving irritant or vesicant chemotherapy experience phlebitis, and 22% patients receiving irritant or vesicant chemotherapy, they experience extravasation. And this fact comes as a surprise to most of us. So this is MAGIC, Michigan Appropriateness Guide for Intravenous Catheter. So if we are planning to use for 3 to 4 or maximum 5 days, we usually go for IV cannula. If patient is critically ill, then we go for midline catheters or acute central venous catheter. For cancer patient receiving chemotherapy, we go for PICC, tunnel catheters, and port. So this algorithm shows the safety of PICC, tunnel, port, and the IV cannula, depending on the days. So the summary is PICC recommended for the vesicant and irritants, PICC recommended from day 1 to long term, even beyond a year, PICC recommended for patient requiring frequent phlebotomy, independent of type of infusion. For long-term uses, all three are possible, PICC, tunnel, and port. So we need to select on the basis of patient factors. So creating Indian algorithm, what parameters need to be focused on? So first is type of chemotherapy, intensity of dose, expected duration of treatment, and indwelling time of VAD, vascular integrity of patient, patient appropriateness. So we need to see what percentage of our patient receives chemotherapy, which is short infusion, less than 6 hours, and less than 6 cycles, or longer infusion, which is 5 FU, or IV maintenance up to 12 months, and the newer drugs like monoclonal antibody and immunotherapy. So lack of venous access may happen due to type of chemotherapy. If it is vesicant or irritant, it can cause phlebitis and extravasation. Then the delivery mechanism, which is repeated venipuncture, leads to phlebitis, and it makes difficult delivery of the drug. Then the difficult venous access, 1 out of every 3 patients, adult patients, have this difficulty. And we know that most of our chemotherapy agents are vesicants or irritants. Vesicants includes anthracyclines, vinca alkaloids, alkylating agents. Irritants are etoposide, antimetabolites, and the taxanes. And most of the time we use in the combination, so we need to be extra careful. So these are the recommendations from ESCO. It is PICC line is intended for patient requiring up to 12 months of IV therapy. Second is PICC line ranges from the 7 days to 34 months. A PICC can be cited for treatment lasting for a few days to many years, up to 3 years. So 4 international authorities have endorsed use of PICC for 12 to 34 months. This is showing the same. Most common use of PICC is for 10 to 73 days. More than 300 days are also frequent. So this is one more data, including 270 PICC line patients in solid tumors. This also showed 3.8 years in India. Several centers have used PICC for 12 to 18 months, so beyond a year. These are the PIV-related complications with chemotherapy, which includes phlebitis, extravasation, repeated venipunctures, replacement. International guidelines recommended choice of appropriate catheter should be based on type of therapy, as we have already discussed, length of treatment, length of dwell, and the vascular integrity. If we are using irritant or vesicant, if the drug's pH is less than 5 or more than 9, And the osmolarity, which is more than 600, then it indicates for the central line. If we are using for the short to long term, up to 1 year, yes, then we should go for PICC, or if we are going for more than a year, then port. So PICC lines are recommended for administration of irritant and vesicant chemotherapy. And these graphs clearly show that PICC ensures the reduced rate of vascular complications. Again, the same guidelines. So this is Grosjean PICC superior performance coupled with proven effectiveness, because it has got three-way well, which reduces the blood reflux and the clotting, controls the flow of fluid for superior infusion therapy. Weekly maintenance is reduced to single saline flush, eliminates confusion of clamping sequences. So this is the diagrammatic presentation of the catheter. So it's a lesser, so this provides lesser vascular complication, longer dwell time, reduced venipuncture, and the improved IVA management. So BD India also ensures the CME online courses, workshops, and patient guide on these. So coming to summary, CVAD is recommended for all vesicants and irritant drugs, all chemo agents having less than pH 5 or more than 9, or osmolarity more than 600. If we are using TPN or blood products, then ideally we should go for the PICC line. Need to make a habit of formally checking or documenting venous status of every patient who will be starting on chemotherapy. Every center must provide option for chemo port and the PICC line. Contrary to common misconception, PICC has been successfully used for short, intermediate, as well as long-term therapy, even more than a year. Benefits in both continuous and intermittent chemotherapy is there. Thank you.
Thank you, Dr. Annu. So with this, we end today's session. And I thank all the audience for the patient hearing and cooperating with us. So hope you have a great Power Pack scientific session. And with this, we move to the, I think, Ganga Ghat and Aarti. So all of you are waiting for that.
Thank you to all the chairpersons and our speakers. Now there will be from 7:30 p.m. onwards, there will be cultural program and dinner at the same venue, this Garden View Hall. Thank you. Thank you.